Hello everyone, this is Kobe with Vance. Vance here, that's right. So today, as usual, a weekly talk show, and we have interesting guests that's lined up over the weeks, and we have a lot of speakers as well coming on board. And today is none other than Dr. Kiru. Dr. Kiru has joined our live chat about a couple of months back. So he's joining back again today with a different topic that we're going to talk about. And of course, the topic is motivational. All right, motivational goals, habits for weight loss. So yes, today we are targeting it more into the health part. But just to talk a little bit of Dr. Kiru, Dr. Kiru is actually a general surgeon and breast and endocrine and bariatric surgeon as well. So he's going to share with us a lot of experience. So we have covered actually a topic about 3 months back, and that topic was actually very interesting. We got a lot of Q&As that came in, and we have a lot of slides to show. So as usual, today is going to be another interesting segment as well. But before that, I'm going to check if Dr. Kiru is already ready. So let me just check. Where's Dr. Kiru? Let me see if I can pull him right now. All right. So Dr. Kiru.
Hello. Hi, Vance.
I'm good, doctor. How are you?
Okay, I'm well. I'm doing great. Thank you.
Thank you, doctor. So have you managed to share the video, doctor?
Yeah. I think I'm on. Can we check and see?
Okay, I will check. But before I will do the checking, maybe you want to do a quick introduction to our viewers?
Yes. Thank you, Vance. So as Vance has kindly elucidated, I'm Dr. Kiru. I'm actually a breast endocrine and bariatric surgeon based in Penang, Malaysia. And it's a great honor to be here with Vance. We go some way back. We did a show a couple of months ago, Vance. I think about 2 or 3 months ago.
About 3 months back.
Yep. And it was and that was during the height of the COVID situation as well, right?
That's right.
Yeah. And so we kind of like hit it off. And I really admire Vance for the work that you're doing.
Thank you.
In trying to simplify a lot of things from a lot of different works of life, different environment, different specialities, and making it in a very understandable way for our viewers to appreciate and to get a good understanding on basic facts from different disciplines. So way to go, Vance.
Thank you, doctor. But I want to ask you something.
Sure.
I think the last time we came in the chat was about 4 months back.
Yeah, correct.
About 3 months, 4 months, right?
3-4 months ago, like, yeah.
Yeah. So what is the secret behind? You look much more younger and younger. I mean, is there a particular well that you're drinking some magical water? I mean, what is the secret behind?
That is another thing that I really enjoy, Vance, because of the sudden things you throw out there and catch me off guard.
No, but it's true. There must be something that you might doing, like taking vitamin C at night or putting some cucumber in your eyes. I don't know. No, you look much more younger and younger, That is a good thing. That's a good thing. Maybe you can.
Yeah. It's fantastic. I must say also, even you look great, Vance. So I think the secret to everything has to be what you do in your life on a day-to-day basis. So I always say, whatever you're seeing is a result of a lot of commitment, hard work, a lot of steps that are taken on a daily basis, Vance. It's not like as you said, sometimes we always wish we had a fountain of youth or a well of wellness at the back of our house. Yeah, so we can just mix it with a pint and just drink it on a daily basis. Yeah, but
Doctor,
actually,
I just tagged you in your Facebook, so you should be getting a notification. So if you can allow the notification, then you will be live as well. So that
right.
Yeah.
Okay,
I just tagged you, you can see. So just allowed it, and it will be in your Facebook as well.
Okay, right. Just that. Is it on?
Yes, it should be coming in your Facebook. Yes, doctor, is on. So
okay,
your
right
now is here.
Okay, good.
So it's my pleasure, doctor. Again, I mean, I got to say that taking out, to get a surgeon on board is very tough, right? You got much things to do. Even if you have some time, the time that you want to spend with your family. But that's one thing that is I'm always grateful that you want to share the knowledge out, because I've seen many of your talks. That I know recently also I saw a couple of engagement that you're doing in, which is very good, and that's what we are waiting for right now. Even when Singapore comes back to phase 3, then we can conduct more live seminars and chats over Singapore and Malaysia. So I think that's going to be a great collaboration in between the both countries as well.
Yeah, I must put my hats off to you so for getting that networking going on, and getting speakers from Malaysia as well, and for us to share and collaborate. And Vance, the reason we chose today is because today in Malaysia, fortunately, it's a public holiday, It's
Okay.
around here. And another thing is that, as you said, we have to coordinate our time. So unfortunately, it's my wife's birthday dinner tonight. And I told them I really have to do this talk. And after this, we are going to go and celebrate later. So no worries, Vance.
Now you got me off guard, because you didn't tell me about that.
I knew if I told you that, probably you wouldn't have gone on air, and
Of
we would have had a
course.
yeah.
Doctor.
It's okay.
I
It's
mean,
okay.
but I really wish her all the best for you and for her as well. I mean, you see, that's then again, right? I mean, you try to put a smoke in front of me, and you got me off guard. So thank you so much. So let's dive into this topic. I mean, before we go into any PowerPoint presentations, we really want to talk about this. I mean, I'm just going to share maybe less than a minute of my experiences. When we talk about motivational goals, habit for weight loss, it's always tend to you take 2 steps forward and you take 4 steps backward. I mean, this is what happens to most people. But there's a certain group of people who are very religious, very focused. They want to reach the destination, means they will reach the destination regardless what. But there's another population, about 70%, or maybe I'll probably might be accurate, or 60% or so, when they put a goal, a motivation, somehow or other it dies off along the path. So that is what we agreed to get into a topic today, and how these can be contributed to that. What do you think about, Doctor? When somebody set a goal or motivationals, they are very hyped up, but somewhere along the way they drop. I mean, I have dropped. I mean, it happens, and it's okay to pull back yourself every time you fall, but it's not okay if you just stay down there. What is your take on that, Doctor?
Yeah, I think that's an excellent question, Vance, because this has actually fascinated me for a long time, because I've been always surrounded by, a lot of people, and we always see that everyone is different. And there's some who, a topic that they want, or something that, that they have made a decision for, and some, achieve it very easily, whereas some, kind of struggle along the way, and some just give up and stop. I've seen it even more, once I've went into this path of, of managing people with obesity, and of course, patients with other diseases as well, cancers and so on. So we cannot quantify and say everybody is the same and expect everybody to have the same results. I think that's where we are struggling as, as healthcare professionals, or even as motivational experts and so on. Because if you really look at it individually, Vance, you cannot use the same formula for everybody, because if that was the way, then of course it's very easy. We can just prescribe everything and just give it out like a flyer and everybody just follow. The problem is you may have a program and you may pass it on to someone, but they may not necessarily follow it because it's not individualized for them. So this is where goal setting, habit forming, and having that impression of who you want to be are all the steps that we advise, but doesn't necessarily sync with the person who is actually on the receiving end of things. So my opinion is that sometimes go slow. If a goal, it has worked, it works for a lot of people, and I'm sure it can work for you as well, provided you take the necessary steps and you know why for your own self, why it's not working for you. So if you know that, and you can probably catch it early, then probably that will be more helpful, rather than just following blindly and failing along the way and giving up totally.
Doctor, because I mean, I'm in the line of fitness and health as well. I mean, you are. I mean, of course, you are in the human body as well. What I notice is that most of the time when they set up a goal, or rather a motivational factor, I mean, coming from either somebody, from friends or families, but I think one part is the desire starts to burn off when they don't get encouragement. So that the encouragement is, of course, families are always encouraging, friends, but there's also another group of people that are always waiting for someone's failure to be their success. So if somebody wants to, lose 10 kg, the other group is always waiting. When will he give up? Because I'm not doing it. Neither you should be doing it. So the kind of a pressure that is always happening in our society, and that actually can cause anxiety, depression. It's a different topic that we are going to right now. But it's okay to fail. And when you set up a goal, when you say that you want to lose 10 kg for better health, it's fine. It's perfectly fine. You allowed yourself to be victorious in your failure. So if you have a failure, it's okay.
Yes.
Appreciate it because you have tried something, but pull back yourself again, be
Yeah.
kind to yourself and move on. I mean, that is what I'm saying, doctor. What do you think about the statement?
Yeah. One thing, when goals and success also is related to failure and demotivation. So it's all in the same spectrum. It's just in the same line, but probably success and achieving your goal is on this side, and failure and demotivation is on the opposite spectrum of the same line. But you must understand, we go through this thing, back and forth in life. There's no such thing as you can achieve all your goals or everything in your life is a success. So speaking personally as well, when I started, running like a half marathons and so on as well, I couldn't even do, like maybe about 10 kilometers or even let's say about 6 or 7 kilometers. I was struggling at one point. But if you keep on, exercising, you build up your muscles, you do your training, you do your, you stick to the simple things, habits, eat well and so on. And slowly you'll get there and you will do it. So the problem is, along the way, some of us probably will feel that, oh, I've tried my best, I've given everything, but I still fail. So I've not achieved my goal, or I can't do it. Why should I anymore? So to prevent that and that negative feeling, that psychology, demotivation, and all, and they totally stop from there. And so that's the problem that we are trying to get this awareness across and say that sometimes, when you can't do it alone,
Yeah.
you need help. Yeah. So I think we as social creatures, we are social people. So we need to be around people to get that positive feeling, that motivation, that the release of endorphins, the release of serotonin, all that chemicals, hormonal chemicals and so on. So I think this is where our information probably will come helpful for people.
Agree, doctor. Agree. I mean, as I've seen a lot of cases over the past couple of years, that especially weight loss towards health issues. I mean, of course, a lot of them have a goal, right? Like a roller coaster. You put on 10 kg and you say, oh, you know what? I need to look good at the end of the year because I'm getting into my friend's wedding, right? So then you go on a crash diet. You do
Yeah.
things that's so tremendous, and I would like to use the word unkind to your body because you're pushing your body too much in a
Yeah.
short period of time. I mean, there's certain weight loss that happen like 10 kg over 2 months. So I'm just thinking, like, say, you're losing 5 kg per month. I mean, it can be healthy, cannot be unhealthy. You can't be drinking water. There's a lot of stuff they might be doing, but
Yeah.
we are now talking about weight loss for health reasons. I mean, you want to look good, of course, for aesthetically for certain sports, or you need to be at certain age and certain weight and certain criteria. That's perfectly fine. But when we say weight loss for health, that is very crucial because if you don't lose the weight,
Yeah.
then your blood pressure, your diabetes, your cholesterols all will start going up.
Very
And that is
true.
why we are now going into the dive into the topic where someone has, say, about 40 to 50 kg of weight loss, and they find themselves having high blood pressure. Maybe their systolic and diastolic can be about 160 over 100, which is about stage 2 blood pressure.
Yeah.
And also putting a lot of pressure on the knee so they can't do much of an exercises. And these are immediate solution that we need to find out how they can actually get into a exercise program, or what will be the medical field in terms of advice that you will give, doctor.
Yeah. Well said, Vance. You know your definitions and so on as well. I applaud that as well because,
Thank you.
as you know, hypertension, diabetes, these are all as what we describe as non-communicable diseases. It's not like COVID where you can actually spread from one person to another. But these diseases is currently the most pandemic sort of diseases in the world right now. Because even in Malaysia now, if you're talking about obesity or you're talking about diabetes and so on, the percentages are so high. 1 in 2 Malaysians are obese. About 20% of the population is currently facing an epidemic of diabetes and so on. So if health awareness is poor, then a lot of individuals will not be taking steps to try to maintain their weight in a lower range, or trying to improve their glycemic control and so on. So this is the issue that we're facing. One is health literacy events. Is our population really educated enough to know? So we're not going even into goals and so on, because if you don't know, then you're not going to set a target for you to live healthily, or for you to eat healthily, or for you to even live healthily. Because your awareness is pretty poor. So having said that, we in the medical line will get cases because of some factors related to your body not being in control anymore. Either you're suffering from your knee pain, or you're suffering from sleep apnea, or you're suffering from biochemical disorders like diabetes or any other issues. And these are the issues which bring patients to the hospital. And unfortunately, at this stage, you are already in an alarm zone. From a green zone, you're now in the yellow zone. So it's time to take action. And if at that point you are actually looking for advice in trying to control your diet and trying to go for treatment, then probably it's a bit too late. You're already in a phase where you need to maintain. You're in a maintenance phase to maintain your blood pressure. So you got to learn that first. Once you maintain that, then you go into correction by trying to lose weight and so on. So again, when this is where you take it step by step. The first goal, second goal, create a habit, and then reach your endpoint. So the problem again, if we set the goal too fast, or too far ahead in front, then I think that's where a lot of it, so to speak, get into complications and kind of like lose hope and so on.
Doctor, because most of the cases that we see, especially for aesthetic, I want to get into the dress, I want to look good. It's been like 3 years I've not get into the dresses because of all the Asian foods that we are always surrounded by. You turn left, there's sugary drinks. You turn there, there's a lot of all the goody foods. We're talking about calories. We are talking about sugar intakes. Doctor, I got to say this, but of course I'm not going to mention the brand. Nowadays you see that things are going a little bit more stricter because all the local governments are putting a lot of pressure, like go on low calories, low sugar. But even the low sugar, there's almost about 10 grams of sugar.
Of course.
That's a bit scary, and if you take a normal one, they're almost about 24 to 36 grams of sugar. So can you imagine in that particular drink, you are making so much and you are just abusing your endocrine system, and which is eventually will not be helpful to you. So that actually becomes a lifestyle, and then suddenly when they do a certain test, when they can check with a doctor, especially yourself and even for any other doctors, then they notice that they abuse the body. So that's where a lot of problems comes in, doctor.
Again, Vance, is the health awareness, because when a company or a certain brand says that we are going into a low sugar production, a product that is low in sugar, it's a diet brand or something like that. Of course, the sugar is still there, but it's just branded in a different way. Instead of using low fructose, you're actually using maybe sucrose or a different form. So that is one issue. The other thing that you were telling is about why is it more easier for someone to set a goal if they want to lose weight to fit into a dress, or to have a photo shoot, and you are more more motivated to lose weight compared to trying to control your diabetes or your hypertension. Well, the easy way to explain that, Vance, is because one is you can see, you can feel, you can hear. You can feel your dress, you can see yourself in that photo shoot, and you can probably hear your friends complimenting, wow, you look great, you look wonderful, and so on. But when you go all out to treat diabetes, it's kind of like silent. What's happening? So it's not a very motivating thing, that I'm going to control my sugar and my diabetes and so on, because you got to prick yourself. And when someone pricks themselves, that also is afflicted with some pain. So you notice all the good things in life are instantaneous. There's no pain at all. The reward is so great. You just enjoy it and you feel that, rush of happiness and everything. But the things that you have to wait over some time to lose weight, to get your health, you have to suffer. You have to go to the gym. You got to meet Vance, and he's got to make you do 20 push-ups a day. And you imagine how much of work, and you only see the result after 6 months or probably, some duration line in front. So when things are wired in such a way, that's why it's more easier for everybody to find the easier route to get instantaneous gratification and happiness. So that's what we're seeing right now.
Doctor, you said so well, because these are the parameters that we have. Even our cars or even things that we buy which valuable, we constantly sending it for servicing, like watch or cars, or even our whatever electrical applicants or even electronics. But the human body, we sometimes tend to keep say, unless it gives us some indications or pain or symptoms, then we try and go and see a doctor. Until then, we keep all the doctors aside. We just take apples. because having an apple will keep the doctor away. I mean, that's what a lot of people believe. But interestingly, I'm just going to talk a little bit on HbA1c, doctor, because HbA1c is not about what you're going to do today. It's what you have done for the past 3 months. So for viewers who are just watching this, I think maybe every year, maybe once, at least once or twice, you might want to see a doctor and get your HbA1c checked. It's your average blood glucose for the last 2 to 3 months if you have diabetes. An ideal HbA1c level should be about 6.5 or below, or if you're at the risk of developing type 2 diabetes, it should be about 6%. So if you're below the numbers, especially if it's 6, then I think you're fine, because without doing that kind of tests or checks, you will never be able to know what condition are you in. So you can do the modification for the next 3 months, but if you don't, then you're putting yourself into danger, because you don't want to go and see a doctor and say that, hey, you got diabetes. Then the lifestyle have to be changed. If you can do modifications, you can prevent it for a decade or 2 decades. But if you don't, then you are developing type 2 diabetes, and then you have all these issues coming up.
Well said, Vance. In fact, I'm so proud of you, because we need more trainers and more fitness experts like you who can integrate both the medical side as well as the fitness side, and of course the aesthetic side as well. So this is what we are talking as multitasking and giving the best benefit to patients who are suffering from diseases. So it's a good thing, Vance. I really think that you hit it on the head with the nail.
Thank you, doctor. Thank you. I mean, we have to work together. I mean, there are a lot of fitness professionals. There's a lot of doctors who are now going into the path of holistic, but I think there's more to be done, because like the other time, if you remember, doctor, we talked about COVID-19 and the pandemic, right? From SARS to Ebola to the Spanish flu. So many viruses just keep on going and coming along the way, as if like they're best friends. But so if we not, we are still learning. We're still progressing. We are emerging stronger. We're getting better and fitter. But then again, we must be prepared for all these uncircumstances situations which might just pop up. With that, doctor, I'm going to hand over to you for your presentations, so that you can explain to us further.
Thanks, man. Yeah, it's really humbling, when you realize one small, virus can actually give us such change in our lives and such complications.
Very true, doctor. Okay. And over to you, doctor, for all your presentations.
I just want to, probably I can share with this. Vance, can you see this?
Yes, doctor, I can. Very clearly.
Okay. So thank you for that. Of course, in anything that we present, I would like to say here to all our viewers as well, I'm not prejudiced. We are not judgmental as well. We are neither industry driven, and I respect individual rights as well. So please feel free to have your opinions on what we'll be discussing and so on. I'd love to hear your feedback. It's all from experience that I have in managing patients, as well in experience with cases of patients with obesity and so on. And everything is backed up with data. And of course, I have a very strong multidisciplinary team to advise in terms of fitness, in terms of motivation, in terms of counseling and so on. So this is where I'm getting my facts from, and it is from real life experience. So the key principles in obesity management, Vance, is about improving the health and well-being, and not only by just reducing the number. You don't want to reduce from a 90 kilo to a 79 kilo and be happy and seeing it on the scale. You want to have every aspect of wellness and improvement in your health, in your joints and so on. And having said that, success is different for every individual. It's not the same. One person may be happy losing 2-3 kilos, but there are some people who, even when they lose 10 kilos, do not feel that happiness there. And a patient's best weight may never be the ideal weight. Ideal weight is basically, it could be 65 kilos, it could be 70 kilos. And you may be weighing at about 80 kilos, but if you're healthy and you're well and that serves for you, then it should be okay. So we tend to agree on sustainable behavioral goals and your health outcomes based on your weight, not only on the weight itself. So Vance, I think we are quite familiar with the SMART goal for weight management. If you want to set a goal, it has to be specific, it has to be measurable. You can't set a goal that I want to lose 20 kilos in 1 week. You have to be achievable. You must be having the power, you must be having the willpower, you must be having the finance if you have to as well. And it has to be realistic. You can't ask someone else to do your push-ups and for you to lose weight, right? So same thing. And it has to be timely as well. That means let's set a time frame, because you got to have a motivation to sustain, to achieve something by a certain time limit. If you set a goal to achieve weight loss in 20 years, then it's not going to happen this year or next year, right? Okay, so unfortunately, I would like to share also that goals alone are not the best tool to reinforce a behavior change. If you focus only on the outcome, beginning with the end in the mind, you realize that both winners and losers have the same goal. If you watch tennis, Roger Federer and the Spanish player, Federer and Nadal, right? Okay. So if both of them play tennis, both of them are playing to win, but one of them is ultimately going to lose, right? So if everyone has the same goal, why doesn't everybody win? Even the loser can be a winner if we accept that. So that's why we say, even if you're doing weight loss, exercises and so on, and you don't achieve the goal, it doesn't mean that you weren't good enough, you didn't try hard enough, or you didn't care enough. It's just that, unfortunately for you, it didn't achieve your target based on what you set out to do. So you got to reframe the situation, you got to change the route, and you got to find another way. So don't give up. So instead of the goal, focus on the habits. What are the habits that you need to succeed? They are simple steps you take, not once in a while, but steps you need to take on a daily basis, every day, without fail. And these habits is the small changes that you take and will set the system for you to win in the long run. And that is what we are aiming for. So you will probably see the results after 1 month, 2 months, or 3 months. Duration will depend on how you put in, on how much effort you put in. So if you see here, Vance, on the left-hand side, this is what most of us will keep hanging on our wall, Okay. I want to have a six-pack, I want to look like Schwarzenegger, and so on. But if your goal is to be healthy, then I suggest to you, if you do have a tummy and you do have an issue with being overweight or obese, class 1 or class 2 or class 3 or whatever, then see yourself doing the daily habits of exercising in the park, or sitting in or playing or running or jogging, and use that as to stimulate your desires as well as your habits and your goals, and focus on that rather than the picture on the left-hand side. So starting your weight loss journey, before you do that, stop. Think first. Have a look at who you are, because everyone is different. So do you need to change your current physical state? If you're in this quadrant, then you know that you need to change your current state where you are in, and you're bound to see results because of your efforts that you put in. But if you need to change your current physical state, but you don't have the time and money, you are making excuses. So you got to allocate the time, you got to find the budget, you got to focus on your health goals, as time and money is not going to wait for you. So how about if you have the need to change, you have the physical state that you want to be in, but you want to do it your own way. And we totally respect that. Yeah, everybody would like to live on their terms. So if your way is by going into Google and searching and looking at Yahoo and listening to your auntie, your uncles and so on, then respectfully try your best, do your best. And if you don't succeed, you will ultimately realize you need a third person to guide you. You need a coach, you need a mentor, you need a Sifu. So this is...
Okay, doctor. I just want to ask you something here. I mean,
Sure.
So we know that, when you burn calories is equivalent to weight loss, right?
Yeah.
So when we talk about weight loss, it can be water, it can be muscle, it can be fats. But generally, when someone want to lose weight, they take it as, I'm losing calories that will equivalent to fat loss. I mean, if you're burning about 300 calories each session on a treadmill,
Right.
about 3,500 calories, I'm just saying an estimation, 3,500 calories is about 0.45 kg of fat.
Yep.
So if you're burning 300 calories a week, so because you're only doing once a week, right?
Yep, correct.
So 3, 6, 9 chop. So you're only burning 1,200 calories per month.
Yep.
So even if that particular person does that for 3 months or 4 months, just by doing that, of course, cardiovascular fitness gets better, gets stronger and fitter and healthier. The heart gets stronger, the pumping system is going on, the circulatory system is great. But how about weight loss, doctor? Because we know that 300 calories and fat loss, it's going to be. But in terms of getting fitter and healthy, you are there. But in terms of size, you are not reducing. So that might be a very not motivating, reducing the goals and thinking that I'm putting so much of effort and energy and sweat, but I'm not losing weight. So that could be an issue. What do you think about that, doctor?
Yes, I totally agree, Vance. That's the reason why when you set a goal, you got to decide what is it that you want. If you want to be healthy, then weight loss is not the ultimate goal that you need to set. Health and weight loss is two different issues. It's in the same line, but it's two different issues. So if you want to lose weight, then we have ways to make you lose weight, to be healthy as well, and for you to burn calories. But as you know, Vance, you cannot just go to the gym, burn calories, and expect your weight to go down immediately without also controlling your diet and other factors also, which are equally important. The first mistake we made, Vance, is that we think that the body is like a machine, you know. If you look at, I keep on saying that we have to look at the first law of thermodynamics. We always say that energy in is energy out, equals to energy out, which is not actually true. There's a lot of resistance going on, and the human is a biological specimen. So we cannot make it so accurate in terms of caloric counting and so on. There was always a certain amount of leeway that we give. So coming back to your question, if you do stick to the habits that you have, that is, you reduce your portions that you're taking, you actually follow a certain caloric requirement that you're taking per day, and you follow the fitness regime that your trainer or the fitness expert puts in for you, you will definitely see the result. But it's not going to happen overnight, and it will plateau at a certain point, and you got to change that again to achieve the next step, and you keep on going as it goes, Vance.
Okay. But again, like what we talk about it, doctor, it's going to be a little challenge, isn't it? Because you might not be seeing that very instant results.
Exactly. So that's the problem where if you're doing it DIY, you're doing it on your own, probably you can achieve to a certain level. After that, you will plateau. That's when you need to get a coach.
Sorry, doctor, if you look at the picture here, when we say spend time on the treadmill, means doesn't spend time like that gentleman over there. He's sitting on the treadmill. Can you see that picture?
Yeah, 1 minute. Let me see. Yes. Okay. Yeah, got it.
So he's sitting down there and drinking and eating, you know. So when we say spend time on the treadmill, means you got to walk. Generally, you got to perspire, not just by eating and call it thermogenic and perspiration and saying that I'm at the treadmill. So that way of being in the treadmill is not a idea. So just wanted to talk about that.
Yeah. That's a reason. Another thing also, you know, when my patients tell me, doctor, why is it I'm in the treadmill for 1 hour per day? And then I ask them, okay, so you're on the treadmill, but what is your setting? Oh, I'm setting it at 2.5 or 5, you know, so the value is very different. So I ask them, okay, what is your heart rate? My heart rate, you know, is about 70, it doesn't go up too high. So we know as fitness goals, you know, you have to have your heart rate going more than 3/4 of your, your maximum capacity. Then only you will see some effort in sweating and so on. So it's not that simple as we put it. You know, if I just walk 2 kilometers per day, if I look at my wristwatch and I'm doing some 10,000 steps, you know, this is all equates to weight loss. Actually, it doesn't. So you need to be educated and know what actually works and what doesn't actually. Right, Vance?
Totally agrees, doctor. So we can go back to your slides again.
Sure. Just 1 minute. Yeah. Okay, where was I? Okay. So let me go back. Sorry, we have to go back all the way. Okay, so we're coming to the last quadrant here, which is the quadrant where I hope many people don't want to be. It is where you accept it that you are obese and you don't care about it. And you're basically waiting for something untoward to happen. This is the group of patients who develop complications like a heart attack or, you know, sudden uncontrolled diabetes. And they tend to be reactive rather than proactive. This is the time when they actually go and seek medical advice and help. So, ladies and gentlemen, I'd like to find out, okay, where you belong on a weight loss matrix. Vance, as you can see here on the y-axis, that is up to down, you see someone about health awareness. He knows his health awareness or he doesn't know. And on the x-axis, either the person is motivated or not motivated. So I always classify everybody into these 4 groups. You have to find out where you belong. So the first group is the quadrant of change. This is a person who knows about health situation that he is in. He is well motivated, and he sees that this is the quadrant of change, the ideal place to be. He's working out, he's doing the best that he can do and so on, and he's achieving results. So this is the place that most of us want to be. Unfortunately, a person who doesn't know about the importance of health, but he's still motivated, is still not too bad. It's the next place to be. But I'll call this the quadrant of effort because there's a lot of effort that needs to be done, and you can get to the quadrant of change. Shouldn't be a problem if you put in the effort the right way. Now, Vance, the dangerous place to be, a difficult place to be is in the quadrant of conflict. This is where a person knows what he's supposed to do. He knows he has to lose weight. He knows he has to maintain his diet regime. He knows he has to stop smoking, but he's not motivated or not interested, or he doesn't have that motivation or even the sense of being, despite knowing that this is a very bad place to be and it's a very dangerous area.
Okay.
Now, worst quadrant to be is, of course, the fourth quadrant. That is a quadrant of ignorance, where you're not motivated and you really don't want to know, or you don't know. And this is where I advise everybody, try not to be here for too long, because we are moving towards a very industrialized country. We are in a region where everybody is advancing. We have telecommunications and so on. So you can't afford to be here for too long, Lamens. Yeah. So my favorite quote is, you can't hire someone else to do push-ups. And I know that, I started doing from 5 push-ups to 10 push-ups, and, currently doing about 3 sets of 20 each.
Nice.
And I know for a fact, another quote from Jim Rohn as well, that your life does not get better by chance, it gets better by change. So you got to make that change. And even our Buddha also has said that from, a long time ago, that change is never painful. Only resistance to change is painful. So when we find that, the pain is much harder for us to bear. With that, Vance, I think that's it. I'd like to end this presentation.
Doctor, compared to 3 months ago and now, you became a motivational guru right now. With so many quotes coming up. But, all these are meaningful quotes, which I feel that, and it's needed to humankind.
No, even we send out a motivational quote to all our patients every morning as well. Because we find that, because it has to be, it has to start from the beginning of the day. If you start the day in the right way, then you expect your whole day to, continue the same until your head touches the pillow in the night and you have a good day.
Doctor, when you talk about the 4 quadrants, I think the first and second are perfect to be in.
Yeah.
I mean, everybody want to put effort, everybody want to put the motivation, the movement, the energy. But when we talk about the third and the fourth, but I think when you compare the third and the fourth, I think fourth is more dangerous than the third. What do you think? I think fourth is very dangerous. At least third, you know something is wrong, but then you don't want to move. But then the fourth is like totally off. So that's a bit scary.
You see, Vance, we are all coming from a generation. Look behind there, you see how many books are there. So we're in a generation where we have to read and we have to find. Now you're in a generation where with your smartphone, you have all the information that you need. Everything is here. So, if you want to Google something about diabetes, health and everything, health checkup, what do I need to know about stopping smoking? Everything is in your fingertips, We don't have an excuse anymore, So information, this is the information age where you have an overload of information. So if you say you don't know, it's kind of like, very difficult for us to kind of understand that as well.
Doctor, I mean, as we speak on to our second segment of our talk session, I notice and I feel that we don't take, when we say we, as human population, don't take very serious about the place that we live in. And that one of the reasons, because we always very cautious about, we are staying in a big bungalows, we are staying in a big condos. That's perfectly fine, right? Or we're driving the fastest car, we want the fastest internet data and movements and computers. But we didn't have a time to put aside and say what is best for us, because we are living within a big dimension of us, but we really don't care. We don't go for our medical checkups. We are not eating most of the time healthy. Our mind, because when you talk about mind right now during this COVID period, there's so much of stress, anxiety. There's a lot of people are going through depressions as well. That's a different way of topic, but I just want to bring it in because I think we are not synchronized, and I think we are not spending time for ourselves. I always love to say that to all my friends and families and even my clients, that you need to date yourself out. So date yourself out means, yes, you are taking care of your family, children, wife, everybody is fine, families are good. But you got to spend me time, which means spending time for yourself is very, very crucial. Go for dinner, go for a movie date, go for a walk, but it's all about yourself because you are dating your own self and you are staying in synchronization. What do you think about that, doctor?
Yeah, I totally hear what you're saying, because I've seen you, lying on the grass and reflecting and like meditating as well. So I totally know that you are quite deep as well, But Vance, having said that also, when we ask ourselves, okay, where are we? Where do we live? So you'll say, I live in Singapore, I live in Malaysia, right? Then we go somewhere down. Okay, for us, we have a state. So I'm in Penang, and then we go even, to our locality, we go to our region, we go to our apartment, our house, and so on. But when you really look at it, man, we are actually living within this body, isn't it? We are an entity. We still don't know what it is, but some psychological, some entity, spiritual power, energy, and so on. But we are living within this body. So this body is basically our temple. If you don't respect it and you don't take care of it, and the wear and tear and suffering and all that will definitely become a burden to you, isn't it? And it's our physical manifestation of what we are going through is the suffering that we are seeing. So I totally get what you're saying. You need to go inward for you to see it outward, I suppose. That's a good way of putting it.
And doctor, as we speak, we have a question that is being posted to us by Audrey Chan. She has asked us, any suggestions to get started? How to get motivated? Maybe you want to take it on your wisdom first before I start sharing?
Okay, thanks, Audrey. That's a beautiful question. Starting is always the first step of 1,000 miles. That's what Confucius has said as well. So let me ask you a question to answer the question. If you want to take a step, right? So you want to make a goal possible. So how are you going to decide? So my advice would be, don't focus on the goal yet. Focus on who you want to be. If your goal is to lose weight, actually, so you see yourself as a person who's healthy, as a person who's well, as a person in your image who has that waistline that you want to be. So if you think about normal, we Asians are supposed to be, if you're a female, you should be less than 80 centimeters. For a male, we should be less than 90. But for a fact, let's just say that I am about 100 centimeters for my waistline. So I'm not going to set a goal of 90. Probably I will accept over a period of 1 to 2 months, physically possible, probably to reduce by 2 or 3 centimeters. Take baby steps and set that as a goal first. Now, once you've set the goal, what are you going to do? There's no point in events that we just say it and we just write it down somewhere, put on the wall, and then, put on your, there's so many things that we call nowadays, your memory board or your vision board and so on. So it's not enough. You got to do something. So if you tend to, in the evenings, have a teh tarik or have a roti canai or something like that, stop that. Do some light exercises first. Get your joints going, get your body going. Maintain on a diet plan for you to, restrict your calories a bit. And then look at that 1 to 2 kilo weight loss. Appreciate that. And then take the next step further. So a goal has to be split over a long period of time, which you feel comfortable, and you go for it. But if you want something more in a short term and so on, then you engage a trainer like Vance, or you can come and see a weight loss expert like myself, or you can even meet someone like your colleagues or friends or anything and discuss this matter. And you put yourself in that time frame and you achieve your goal over some time. But you got to do something. That's the most important thing.
Nicely said, doctor, because I think that's one of the wisdom word that, is straight and simple. I think keeping it simple is very, very important. I think you said it well. I think, Audrey, because I'm not going to go into the started part because doctor has already covered that. I'm going to go into the motivated part because the few 6 factors that I will talk about is the ways to get motivated. Regular review your goals and progress, which means that whatever small goals, it's always good to have smaller goals rather than bigger goals, because sometimes when we put a bigger goals and we, as the path goes on, and if we can't reach it, sometimes we get demoralized along the way. So you are the best motivator for your own self, because if you always expect someone to motivate you, especially your loved one, they will be there. But if you always expect someone else from your circle line to motivate you, that's going to be a big challenge, right? I mean, sometimes they might not be free, they might not be available at your convenient time. All right, continue to set new goals. I mean, smaller goals, when you achieve it, you get even more motivated. So I will suggest that smaller goals will be better, because then you get even a self kind of realization that you achieve it. Number 3, keep the momentum up, because momentum is very important, because the moment you slow down, that's it. You feel that you are defeated, right? Yeah. The 4th one, maybe also would share with doctor, mentor. Have a mentor who is experienced and also will be able to guide. But unfortunately, nowadays, mentors are, everybody can be a mentor right now. So you must be very careful who would you choose your
Yeah,
mentor to be?
very
You
true, very
don't
true.
choose otherwise, because then you can be,
Yeah,
the result will be the otherwise as well. So you got to be very careful who you get your mentors. This number two, the fifth and the sixth that I want to love to share with is surround yourself with positive people. Very, very important.
very true,
Energy are very, very important.
very true.
If you choose to stay with people who always give up, they always say no, lack of energies, they can actually drain you down as well. So always surround with people who are positive, and exercise. Exercise is another part to stay motivated. So you see, you have all the 6 pointers right now, Audrey.
Yeah, excellent. I totally agree.
Thank you, Audrey. Thank you for that. So, Doctor, so now we look at the PowerPoint. So now we come back to the PowerPoint. If any of our viewers have any question, please feel free to ask. I mean, within our knowledge, within our experience, humble experiences, we can able to get some answers for you. If
Yep.
we don't have it, we will definitely try to get it. I mean, that's how we learning should be done. All right, we always keep on learning from each other and improve. So, Doctor, when we look at the PowerPoint, there's two things that capture my attention,
Yep.
because you attracted very well. One
Yep.
is because you're looking very youthful. The one, your PowerPoint is also very attracted. So I'm also getting very attracted because of the attention.
Yep.
Um,
Yep.
the one part I saw was a lady was lying on the grass. All right,
Yep. Yep. Sure.
and another one is a bodybuilder that's standing there. So
Yep.
now this is the thing, Doctor, that what we want to find out, or what we can share with our audience is having a good body. All
Yep.
right, it's aesthetically, a goal that they want to achieve. That's fine.
Yep.
But in terms of health, is there some cases where people are in good shapes but also have serious medical chronic illnesses?
Yeah. Yeah. That's a good question, Vance. Uh, to tell you the truth, yeah, because we do see patients who are physically well from the outside. That means they are in the good BMI range, maybe slightly overweight or almost normal, but still having other pathological diseases. So just because you're in a normal BMI or normal weight range does not mean you have a license, against other illnesses and so on. I know because as a surgeon, we see a lot of patients, unfortunately, suffering from cancer, even younger age group nowadays. Just the other day, I had a patient who was about 23 years old, diagnosed with uh, colon cancer as well. So, we hope that this kind of very devastating diseases don't occur, to everybody or at any time. We really hope that it doesn't. But unfortunately, not being in that ideal weight alone is not the only thing. Okay, there are other factors as well: genetic, environmental, and so on. So these are the points or the things that is beyond our control. When this is what we call as act of God. A tsunami coming or the COVID coming and all that, it can't be predicted. So it does happen. But what we are trying to control is the things within our influence. That is, what are the steps we can take to protect our health, to maintain ourselves, to prevent chronic diseases. What happens if we continue smoking when we are told that we should stop? What are the issues? So these are the things that we're doing, and even the positive things, even Vance. Some of us are, even I'm guilty at sometimes with that as well. We overwork. We have so much of deadlines, and we have cases and so on, and we just put our bodies through a lot of hard effort and work. Not only the body, the mind as well, because you're constantly thinking and pushing yourself to the limit. So coming from there, I think it's a good thing to advise everybody. Sometimes you got to take one step back, like you said earlier. So take 2 steps back actually, and kind of like relax. Take some time off, spiritually, mentally. Try to engage yourself, spend time with family, and so on. I think this is the good things that we probably overlook. And the best part is not a treatment, and it's totally free, events. It's totally available at any time. So all you need is just a bit of vitamin C. C being go to the seaside and
That's
enjoy
a good
yourself.
one. Yeah.
Yeah.
And especially during this, I mean, now as we recover from COVID and going into different phases, right? I mean, in Malaysia is MCO, in Singapore is circuit breaker. As things getting better, but also situations also should be better, must be better. So these are the positive words that we love to use. But
Yes.
unfortunately, the real fact is things are going a little crazy at the moment.
Yeah.
Things can get better, but we got to prepare, anticipate for the worst. I mean, to be very realistic. But I think one part that we need to take note here is our mental strength, because if we are not exercising, when we talk about exercising, that's what doctor said about walking in the sea, seaside, spending time with our own self is very important. Spending time with your loved one is very important, because if we don't do that, that means we are not doing in check. Because right now, doctor, you see, we are wearing so many masks, innocent mask, friend mask, family mask, stress mask. So there's so many masks that sometimes we forget to realize ourselves who we are,
Yeah.
which role we play, and where do we stand. And constantly we are trying to impress others, and we're always getting validation from others so that we feel better. It's something like a like button, right? Somebody
Yeah.
give us a like
Yeah.
button. Oh, I got a like.
Yeah. Yeah.
But
Yeah.
you should like your own self. I think that is the most important thing, because depression is for real, mental weaknesses is for real.
Yeah.
It can affect your anxiety, and then it's a big health big list that comes in along the way. So
Yeah.
in that manner, I think, doctor, we both agree that exercise plays a part, but at the
Yes.
same time, we have to take care of these mechanisms. So we have to go and check the doc. I'm sure doctors are all friendly, right? I mean, they're not very. It's not like those cinema where they put a big strange and no more, right?
Yeah. Yeah. We don't bite Vance.
So even they think the personal trainers are them as well, like pushing like army drills, like push out, shout, but we're not. But these are just a profession that we do with full of passion. So I think, what is your recommendation, doctor, for everyone? Is it at least twice a year for a medical checkup, full medical checkup, or is
Yeah.
it every 2 years? What is the recommendation?
Okay. Yeah, I think first thing, Vance, like what you said, people before used to be afraid to go and see the doctor, or see a fitness trainer, because of fear that they're going to be burdened by what is told. But I think if you think of it very closely, what they're actually afraid of is the fear of the diagnosis. If you're
Yeah.
being told that suddenly, we found a lump, or suddenly, your sugars are so high. Sometimes, so maybe this. The diagnosis itself is something that is causing them to be afraid, possible.
Mhm.
Some patients actually told that to me, that they delayed their medical checkups and so on, was because they were afraid. And another group would actually say that the reason why I delayed is because I just have no time. So if you are always hiding in the fact that you got no time, and you're not making time available for you to go and get yourself checked, then you got to make time available for you to suffer from a disease that you could have avoided. So
Can we put these? I mean, of course, nobody wants to know the truth, but
Yeah.
sometimes truth hurts. But sometimes truth also helps to save lives.
Yeah,
So in the
correct.
four quadrant of ignorance and acceptance,
Yeah,
and
yeah.
what category they fall into, doctor? I mean, which category do we put them in?
Yeah. So this person knows, he knows, but he doesn't have the motivation to try to get it sorted out, and so on, because he knows that he has to get well. He has to be well. Sorry, he has to be well to work and so on. But he accepts it that he's tired, lethargic, and then he feels that that his pants is getting tighter, and he knows that he's putting on weight and so on. But he also knows that he's putting his priorities elsewhere. Earning money. I need to earn for my family. My children are studying overseas and so on. So if I stop now, then they are going to suffer. Or I'm not going to get the reward that I need. So go through, soldier on and push, and ultimately your body, like I said, it will crack at a certain point. And when that happens, then the issues are far much more bigger than what could have been trivial earlier. So this is where we, like what you said rightly, is that they should actually go for their health screening, checkups, and so on. Keep themselves, maintain yourself like a prize, boxer, or one of our top athletes. I think a lot of athletes, right, man? So most of them maintain themselves at a very high level, good nutrition, good this one. And these are the same players in the Premier League, who are earning millions and millions of pounds. So that's how they maintain themselves. So I think we as individuals, lay person as well, should follow that same. We're not earning that much, but at least we should maintain ourselves to a little bit of that level, I feel.
You know,
Very,
we work very hard, like what you say, doctor. I mean, spot on. Yeah, we
yeah,
work very hard to chase after the dollars,
yeah,
right? Then we capture the dollars, and then later you will see that it affects our health, and then the dollars running away from us. What
yeah,
we
yeah,
caught is what running away from us. So health is wealth, wealth is health. I mean, the one nobody can deny that. We
yeah,
have
great,
another viewer by the name of Ashwin.
yeah,
So Ashwin has asked us, what about hormonal diseases? These tend to affect motivation, even though one is pushing as hard as one can. So here we
yeah.
have hormonal issue, but in terms of that particular person, he is very determined and motivational. He has that effect of motivation, even though he's pushing hard. So there's
Yeah.
two unbalance there. What do you think about that, doctor?
Yeah, it's very true, Ashwin. I think it's a very, very good question that you have asked. Hormonal diseases is something that a lot of people don't know. You know, hormones are like, for example, when like your thyroid hormones or your insulin or your, female hormones, like your estrogen, progesterone, male hormones like testosterone and so on. So these are things that you can't see, but you can measure them. And they tend to manifest in diseases in the form of behavior changes,
Yes.
very low mood, very low, lethargic, very, you feel sleepy. So hypothyroidism is one classic example. Okay, so Ashwin will address about, let's say, hypothyroidism. So yes, it's very true. That can affect your motivation, not in a small percentage, a very large amount, because it's beyond your control. When we're talking about motivation, about what we're thinking and so on, this is all our prefrontal cortex, This is the newer part of our brain that has developed in the last 20,000 years or so on. Now, hormones and everything are under control of our feelings, our behavior and so on, which is under our limbic system, which is already in existence in many, many millions of years. So as you can understand, when we try to control something by thinking about it and by saying that, oh, I got to be motivated to do this, you will, hands down, you will definitely lose to the effects of these hormonal diseases that you're suffering from. So it's very important, Ashwin, and for our viewers out there as well, you got to get yourself checked and see whether you are suffering from these conditions. Because if you have tried for a certain time, Vance, and you're not getting anywhere, you feel that you're suffering, demotivated, and so on. This is the time that you need, like I showed you, you're in that the third quadrant. You need to get help at that time. So don't leave it for too long, because if you are hypothyroid for a certain period, for let's say years, you tend to develop heart diseases. You tend to develop complications related to your skin, water overload, a lot of issues as well. So that's my advice. Please get yourself checked up.
Thank you, doctor, for answering Ashwin's question there. Ashwin, hope doctor has answered you. So if you do have questions, please post us, and we try our very best to take it on any level.
Yeah.
We also have Mr. Diego Gracia. I call it the Formula One tune-up. Regards from Dr. Roland from Sky Clinic.
Oh,
Must
yes.
be your friend?
What's up? Yeah, yeah. He's from a clinic, Sky Clinic, which is based in Kuala Lumpur. So we have a viewer from Kuala Lumpur as well. And love your name, Diego.
Diego. Thank you there. So again, we're coming back to Ashwin again. Yes, hypo for sure. I'm going through that exactly as you're described, Dr. Kiru. My explanation helps. Thank you, Ashwin. Thank you for that.
Really hope that you get well, Ashwin, because let me tell you, a lot of these hormonal problems as well are treatable. So if you get the right this one, you just need a tablet replacement of replacement hormone with thyroxine, and that will bring up your levels, and it should improve your system. And of course, like Van said earlier as well, once you're a bit better, go for an exercise, because all our endogenous hormones and the feel-good factors and everything is actually within your serotonin, your endorphins, your good hormones that you have as well. So we just need to trigger that, and the most effective way is by exercising, of course.
There you go. Yeah. All right, Ashwin. So you know what to do next. Take out your jogging shoes. What you have, get started on your exercise program gradually, slowly. If you need any help, you know what to do. Just beat me. I come to your assist. We also have Lean. So yes, Lean, how are you? Yes, I do still remember you. Hopefully you are in Singapore right now or Philippines. All right. So, and also, doctor also has replied. Thank you, Dr. Roland. Right. So, thank
Yeah.
you. Thank you so much. So, yes, keep on coming on the questions. We are taking the last 5 to 8 minutes more of questions in. So, if you do have any particular questions, or you just want to say hi to our handsome doctor here, I still haven't get the answer from you yet. How is that possible? 3 months ago, and now you're much more younger because I can see the glow in you, even though we are probably about 200 kilometers away or 300 kilometers. I mean, about
Yeah.
there.
Yeah.
But I can see the radiant and energy that is, coming back to me back and forth. So we got to know what is the secret so that our viewers will also be happy also.
So it looks like you're going to come to Penang then, because I think since coming here, I felt, of course, the lifestyle as well, because despite busy with work, I do spend a significant amount of the day as well to carve out some time, especially in the early mornings for a jog. So I've got my timings earlier, and I try to do that about 5 to 6 times a week. So I'm achieving good results, thank God, and probably that should be one of the things. And of course, maintaining your food intake is very, very important as well.
I think the magical words, doctor. I mean, we talk about the magical well that you might be drinking water, but maybe we might change it to the magical well with magical sentences, right? Eat
Yeah.
well, sleep well, take care of yourself well, love yourself well. I
Yeah.
think these are basics, but sometimes in a rush world, we totally forget about that. Everything we are rushing for everything, rushing to work, rushing to come back home, rushing to sleep, rushing to go
Yeah.
to the toilet. I mean, to a certain point, you will realize, why are we rushing so fast? What is the whole purpose of life? Why don't
Yeah.
we take a chill pill? We got to take a chill pill. Our human body is not a mechanism, can change, replace parts. I mean, of course, some parts can be changed if somebody is donating it, but other than that, I think we need to put so much of concentration on ourselves to get synchronized and
Yeah.
be in sync with our maximum peak of health.
The problem with that, Vance, if we do start going on and talking like this outside, then
Yeah.
people will just tell us, go and fly kites.
But
because sometimes, like I said, people are very different. Sometimes the wake up call will come when you have a disastrous problem in your life,
Yeah.
and that's the time when they decide and they look at it differently. So until that happens, they only have information from what people like us are telling, or from what information that is available in their circle of friends or community or so on. So if everyone around you, Vance, are eating in fast food restaurants, lack of exercise, and even in the same family as well. So if you're in that environment, so I always say environment is very important, like what you said just now also. You got to leave that environment and go to somewhere new and start fresh. For you to, start. But not all of us are able to do that.
And also, doctor, I mean, we saw some of our viewers also posted some questions relating to health, but I always believe, and we always believe, because you are a person as doctors. I mean, you spend at least a couple of years studying about the body system, how it works, what are the things can go wrong, what are the things can go right with the medications and concepts. It's a big science that you have done. But what I know on little information on myself about my body is that when you have pain as an indication, that means the body is already almost giving up on you.
Yeah.
All right. If you have if a pain is a indication of a problem that is already there, if you ignore the pain, then it can be very dangerous. It can be otherwise, especially if you feel pain in the upper region part of the body, especially closer to the sternum, which
Yeah.
is a part of your heart. If you got a pain, you go to bed quickly, put everything aside. Everything can wait. Go and attend to the medicals, doctors, and get yourself checked. Don't say, oh, it can be a muscle pull. It could be, but I think these are all indications that we need to listen and act promptly, which is, I think, very, very important.
Very true. Very, very true, Vance. In fact, like what you said is so important that I always feel that in every family, it's always best to get someone to be trained for CPR.
There you go,
Because
doctor. That's right.
yeah, because you never know. Nowadays you're looking at all the age groups whereby heart diseases or even sudden cardiac arrest happening is getting younger and younger. It's
Yeah.
getting shocking. probably, when you're in the bus or something, someone is just going to collapse and you need to attend to that person immediately. So it's not something that you're going to lose out, or you're going to suffer from, learning all the simple things like what the education that we're giving for free online and so on. So you just got to choose your resources and get the right advice. And, I think you'll live a good, long, happy life.
Doctor, our best friend, I mean, since we're on the topic of the main pumping system, the main guy, the love, the heart shape. But of course, the anatomy is not a heart shape, right? I didn't know how it came by. The heart shape is never a heart shape. It's a different chamber.
It makes you wonder.
So, since we are in that topic, I'm just going to cover a little bit about the statistics in Singapore. Sure. Every day, 17 people die from cardiovascular diseases. That's a bit scary, and it's about 29.2% of all deaths in 2018. So these statistics is in 2018, and that means 1 out of 3 deaths in Singapore are due to heart diseases or stroke. Because it's a bit scary, because our lifestyle, stress, and even if you look at, a little bit there, smoking, drinking, eating fast foods, and, not exercises. So these statistics are a bit scary. So we need to take control of our life. If not, we might just lose it.
Yeah.
All right, Doctor, we have coming up to the last segment. So it looks like Dr. Ronald has also mentioned something, hormone, the feel-good chemical factor that is not seen during screening, especially during screening. So when you do a certain test, I mean, of course, when you do a blood test, I'm sure then you can able to read all these parameters, right, Doctor?
Yeah, I think what Roland is mentioning is that when we test for hormones, the hormones that we checked out are like I mentioned, thyroxine, or estrogen, progesterone, and so on. But the other, like what he said, feel-good hormones, like serotonin, oxytocin, prolactin. Prolactin is basically this hormone that is produced from the pituitary gland for breastfeeding mothers. So in the pituitary gland itself, there's another hormone called oxytocin. So when you realize that when we shake hands or when we hug, we have a sudden very body feeling, contact. Right? The warm feeling. That's all because of oxytocin. So so unfortunately now, when we are in a COVID situation where I can't shake your hands, I can't hug you, and if you're in a European country, they have this pecking of the cheeks and so on. So this is like showing affection. So you feel good, community, and release of a lot of good feel good hormones as well, and that's how relationship grows. I trust you, you trust me, and so on. So this is basic human evolution. But now we're in a situation where we are not allowed to do that anymore. So, and imagine yourself walking around with a mask. We always associate someone wearing a mask as a crook. You're either a crook or you're Batman lah. But of course, so we tend to associate that these guys are crooks. You're not honest, you're this one. And now everybody around us is wearing a mask. So again, if I saw Vance without wearing a mask, without that wonderful beard that he has, I'll be a bit worried in the dark. Because I won't know him.
You cannot be able to recognize me, right? I mean, nowadays we can't even recognize our friends and families, because normal days already we do not sure what they are talking about. But the moment you wear a mask, you can't even understand what they're trying to say. Yes can be no, no can be yes, mumble, So this is the new normal that we are living right now in this pandemic.
So this is the same thing, Vance. When we look at it, if you are not wearing a mask, I look at you, it's Vance and everything. So I know you, you know me, and then we have that good feeling and everything. Whatever you tell me, I take it not with a pinch of salt. I really appreciate it and this one, and I will do it. So if Vance tells me, oh, okay, Kiru, your push-ups are not right, you got to improve it, move your stance a bit and do it, I will listen to you, because I know you, and we have that relationship and so on. But what's happening now is a lot of people don't know. We're not getting the facts, the data. Same like wearing a mask. We're hiding behind it, and we're not looking at the person in front of us. So we're not accepting the data, the information, and so on. So we tend to be very reclusive, and then we are suffering from the effects that is happening in the world around us. Yeah.
No, but even I have to agree with you that the nowadays students are very happy, because when they wear a mask and they yawn, the teacher cannot see. They're yawning 10 times throughout the class, but the teacher cannot find, because everything is under the mask. They're yawning 10 times, like, oh, even if they smile, so
Yeah.
not sure. See? So this is the new world that we are living right now.
Can you imagine, Vance, if there was a disease that was transmitted from looking at each other, then
Yeah,
all of us will be walking around with sunglasses,
exactly.
You won't be seeing the eyes then, right? So it's really a perspective, lah. Wow, very funny.
I mean, I got to say a very big thank you to you, doctor. I mean, there's no words to describe. I mean, for spending almost 11 minutes, 1 hour, 11 minutes, and of course, a wonderful audience who are asking us questions and giving us the opportunity to share our experiences. Because when you don't share as you keep it, you feel something a bit weird, because you know that if you can impact someone, at least the
Yeah,
two people or one people, at least we know that we have done a fantastic job for the day. That give you a little happiness, that we have done our
yeah,
job, even to make you understand or ask questions like Ashwin and Audrey. So we really thank them for the questions as well. Any
yes.
wisdom words, doctor, apart from the wishing well?
Yeah, I would like to say, Vance, yeah, again, I'd like to end by saying that you're doing a fantastic job. Really appreciate being here as well. And I really hope, I think the reason why we do this is because we love humanity and we love, sharing awareness and creating it. So I think if everybody feels the same way, then, it's a great thing, keep sharing, keep joining, keep creating a community. And I think if we keep doing the right things in life, I think everybody, somewhere the impact will spread on to somebody else. And like you said, even one or two person who gets this information out there and shares it, I think it's a good thing that we have done. And I think we can sleep well tonight and knowing that we have done a great job. With that, thank you, Vance.
Thank you, doctor. Thank you so much again, once again. Doctor, is there any contact information of yours where any viewers actually can contact you? The one with the Hotmail, are you using it, doctor?
Okay, yeah. Maybe I can share with you the current this one that I had, which I showed earlier,
Okay.
uh, because I'm using my Gmail account now.
Okay.
And, that is directly linked to my clinic as well.
Okay.
And
So if you can share it in the slide, then I can show them. Yeah.
yeah, sure. So I'll put it at the end here, and they can even contact us on Facebook as well. We're always available at my this one, which is called Penang Weight Loss.
Okay.
Sorry, I just went too fast there. Okay, this is the slides that I shared earlier. Yeah. So yeah, this is the
Okay.
okay. So yeah, you can either contact us on Facebook, Instagram, Gmail, and that's my personal email on top there, Mr. Kiru Bakaran. So always contactable. Please drop me a line. Feel free to share with me your any questions you may have, and God willing, I will reply you as soon as possible. Thank you.
Doctor, you got to be very careful when you say that, to contact you, because someone might call you or message you at 2 a.m. and ask you, sir, ஒரு doubt இருக்கு sir. And then you don't want to entertain. Then probably you will call me, say, Vance, what's happening? I say, why? Somebody calling me and ask me for doubt.
Oh, that's a good one. Okay, Vance.
All right, doctor, thank you so much. So we will stay connected, and probably our third interview session in the upcoming weeks and months ahead, that we can plan another one. If our viewers enjoy it, please say thanks, please share the video, or even say hi to doctor, not at 2 a.m. Any particular medical questions, I'm sure he can help you. Anything related to the fitness and health, you can also ask us, not a problem. Signing off, Kopi with Vance and Dr. Kiru.
Thank you
See you,
so much.
doctor.
Have a great week, Vance. Take care. Stay safe.
Take care. You too. Cheers.
Cheers. Good night.